Let's talk about the 4 criteria or pillars for a successful weight loss program. These pillars are a must, not just for weight loss, but also for maintaining the weight that you have lost. Number 1, medical. The first criteria is medical support. We know that excess weight is a disease, so why not have a physician who has the expertise in this area lead the treatment? Having excess weight is not all about eating too much or not exercising enough. In fact, science tells us there are many things beyond poor habits which lead to weight gain. Things like hormonal changes, metabolic changes, genetics, ongoing medical conditions, medications, stress, and even lack of sleep. This is where the expertise of a board-certified obesity medicine doctor comes in. The physician can also prescribe and manage the use of prescription medications that can help with weight loss. Number 2, nutritional. The second criteria for a successful weight loss program is nutritional support. Dietary changes play a significant role in both weight loss and weight maintenance. In fact, when it comes to making dietary changes, it's not one size fits all. It's very important to have a customized dietary plan for each individual based on their health, their likes and dislikes, and their long-term goals. Number 3 is behavioral. The third criteria is behavioral or psychological support. We are all guilty of stress eating and mindless eating. We can easily undo weeks and weeks of hard work with just a few days of bad eating from stress. Without the behavioral support, a weight loss program is certain to fail. Behavioral counseling helps to keep us motivated and make the lifestyle changes needed to lose weight and keep it off. And the fourth criteria for a successful weight loss program is physical activity. It's very easy to tell people to just go home and exercise, but we all know that getting started is the hardest part. Just like an eating plan needs to be customized, an exercise plan should be customized also based on each individual, their age, medical history, and long-term goals. Having guidance from a personal trainer or an exercise physiologist can make exercising more enjoyable and more effective. Proper guidelines can also prevent any potential injury from working out. So as you can see, weight loss takes a team approach from a physician, nutritionist, behavioral specialist, and a physical trainer. Now, ideally, how nice would it be to have all this under one roof? You can do just that at Physicians Premier Weight and Wellness Center. We are a physician-led weight loss program with a team of experts that will provide you with the medical, nutritional, behavioral, and exercise support and guidance. Give us a call at 703-783-5673 or visit our website at healthymeweightloss.com for more information.